Welcome to the NIOS studio. In this video, we will discuss Chapter 8, Health. As you can see a triangle in the picture, there are three words written. One is mental, the second is social, the third word is physical. Our health is a combination of all these three words in practical. Or we can say our health is combination of mental, social and physical. Objectives of this lesson health are: we know about our health, we understand the signs of physical, mental and social health, we understand factors affecting the importance of health, we understand the indices of good health. Also, we understand immunity and health and the immunization schedule. Let's understand health first. The word health is derived from the Latin word hel or hail, which means whole, sound or well. There is a world level health organization. Its name is World Health Organization. In brief, we call it WHO. It was started in 1948. According to WHO, what does health means? WHO says health is a state of complete physical, mental and social well-being. It does not only mean the absence of disease or infirmity. Now let's understand the meaning of good health. People enjoying good health are more cheerful, energetic, full of life, more efficient at work, and therefore more productive. Good health means proper functioning of the body and mind and signifies different dimensions of human life. Let's understand physical health first. As you can see in the picture, physical is related to our physical body. If our body is functioning well, it means our physical health is good. There are some signs of good health, like rounded and pink nails, healthy, clean and smooth skin, bright eyes and good vision, odorless breath, alert and energetic, normal weight for your age and height, good appetite and digestion and regular elimination, shiny and lustrous hair having natural color and texture. If all these signs are there in our body, then we can say that our physical body is physically healthy. Now let's understand the word mental health. As you can see in the picture of mind and heart, and a positive sign in the mind and heart too. There are few signs of good mental health. You are considered to be in good mental health when you can control your emotions, when you can have helpful attitude towards other, when you have ability to seek help when needed, and when you have confidence in your abilities. Also, when you have balanced feelings, desires, ambitions, and ideas. An ability to cope with day-to-day stress of life. Ability to accept the realities of life and face them. Let's now understand the third word, social health. As you can see in the picture, there are many people joining hands together. Social means people around you are involved and your relation with them. When you have a positive attitude towards life, when you have healthy interpersonal relationships, when you have a pleasant personality, when you get along well with others, your responsibilities and duties towards others, be able to accept disagreement positively. These are all signs of good social health. Now, if we talk about personal health, there are some factors which affects our personal health. Like in this picture, you can see cross signs. Alcohol is not good for our personal health. Drugs, bad drugs are not good for our health. Smoking is also not good for our health. On the other hand, good hygiene, balanced diet, and relaxation and sleep are good for our health. There are some other factors which govern our health and behavior. In this picture, you can easily see and understand the topmost circle shows social support. When the society where we live and the people around us, they support us, that is social support. On the right hand side, the green circle shows income and social status. Income, you can easily understand the money which comes to you through salary, you earn money, and the social status is the quality of life we live. The third circle is education level. Our education level also is an important factor which governs our health and behavior. The next circle is physical environment. That is also an important factor which governs our health. Next circle is employment and working conditions. Place where we work and how we work. That is also an important factor which governs our behavior. The next point is gender. The male, female. Accordingly, our work routine is an important factor which governs our health and behavior. Next point is cultural practices. The place, the society we live in, and our cultural habits, cultural practices influences our life. So this is also an important factor. The next point is access to health services. Now let's understand the word balanced diet. Balanced diet gives good nutrition, which maximizes the energy level and protects health and prevent diseases. To eat balanced diet, follow the food pyramid. Like in this picture, you can see the lower level, it shows cereals, wheat, corn, rice, and some dals. The next level is vegetables. In this pyramid, you can see cereals and millets are at the lower level. They are an important food item in our meal. The next upper level is vegetables and fruits. Above that is milk and milk products, pulses, and the topmost level you can see in the pyramid is sugar. Sugar is required in the body in very less quantity. Now let's talk about personal hygiene. You can see in the picture and understand easily, brushing the teeth regularly is important for oral hygiene. Bathing daily is important for our physical hygiene. Visiting toilets at a routine level is also important for our inner hygiene. Hand washing after every use of toilet is also important to keep us healthy. If we are clean, it helps us to be healthy. Now let's understand domestic hygiene. Domestic is related to home. our food at home, if our food is covered, if the garbage is also covered, it is not kept in open, we use napkins whenever we sneeze, whenever we wash hands, and we use separate napkins for separate persons. Proper use of dustbin and cleaning. All this comes in domestic hygiene. Let's understand food hygiene. Food, being perishable and nutritious, is a breeding ground for germs. So use clean water supply for drinking, cooking, washing utensils. And also wash fruits and vegetables in clean water. We should throw away the spoiled food regularly. Eat the food at high temperature to kill germs. Let's understand how the relaxation and sleep is important factor for good health. After the day's hard work, you become tired. Your mind and body need rest. A little nap, a regular sleep, and relaxation for some time will make your body and mind fresh again. Avoidance of alcohol. Drinking alcohol may lead to health problems such as loss of senses, digestive problems, liver damage, heart failure, etc. Therefore, alcohol is not good for our health. We should avoid it. Avoidance of smoking. Smoking is injurious to health. It damages the lung, gums, teeth, and cause of lungs and mouth cancers. Therefore, we should avoid smoking. Avoidance of drugs. Drug abuse is an illegal activity. It adversely affects the liver, kidney, heart, and may lead to death. Therefore, we should avoid drugs. Now, let's understand the word community health. The community health is the practice of preventing disease and promoting the health of a population through the organized efforts of society, public, and private organizations, communities, and individuals. Important concerns in community health has 4 important factors. The first is water supply. The second is garbage disposal. The third is outbreak of infectious disease. And the fourth is natural calamity. Now let's understand all these 4 points in little detail. The first point was water supply. Safe drinking water is everybody's need. Water supply comes from the main community resources such as domestic water pipeline, hand pump, etc. The second point was garbage disposal. Garbage disposal is done in each home, then it goes to a common place far away from the living area where it is treated. If not collected for many days, bad odor emanates and mosquitoes and flies breed and causes a number of diseases. The third point is outbreak of an infectious disease. Sometimes there is sudden onset of disease in a community. It is referred as outbreak of an infectious disease like dengue or malaria. The fourth point is natural calamity. A natural calamity like floods, tsunami, landslides, earthquakes, etc. take heavy toll of lives, and it is a serious matter for the community and the nation. Now let's understand few activities which help for community health. Maintain cleanliness of the villages, towns, and cities. Garbage disposal is important. Supply of clean drinking water is important. Waste collection, etc. from the locality is important. Next point is ensure standards of food stores, meat and milk outlets. The third point is organize health promotional activities. The next is arrange camps for immunization, prevention, and treatment of several diseases. Like there are some national health and nutrition programs, National Malaria Eradication Program, the TB Eradication Program, National Immunization Program, National Pulse Polio Program, Integrated Child Development Services, Midday Meal Scheme, National Nutritional Anemia Prophylaxis Program, Iodine Deficiency Disorder Control Program. Let's understand immunity. It is a biological phenomena. Immunity is a natural defense system of the body to fight against the disease causing microorganisms. These microorganisms are known as pathogens. Pathogens are example bacteria, virus. Few bacteria are good for our health, few bacteria are bad for our health. Now let's understand two main agents or soldiers of immunity system: antigen and antibody. Both these two, antigens and antibodies, help our body fight with the disease. These two agents are present inside the blood. Antigens are foreign particles or microorganisms against which antibodies are generated in the body. Antigen induces the immunity, and the antibodies are protein molecules produced in the white blood cells or lymphocytes to counteract the antigen. These antibodies identify or neutralize the antigen. When pathogenic bacteria having antigen attacks the body and the body does not have enough antibodies to fight the antigen, then the symptoms or the disease can occur. Now let's understand natural immunity. It is inherently present at the time of birth. It provides protection from the disease. It prevents the entry of pathogens in the body. Skin, mucous membranes, hydrochloric acid in the stomach, and white blood cells play an important role in it. The second immunity is acquired immunity. It develops during one's lifetime through antigen-antibody interaction. This is a specific type of immunity where each type of antibody acts against a specific antigen. Each antibody remembers and recognizes the specific antigen and destroy them when they invade body again. In this diagram, you can easily understand immunity is of two types. The below one is innate immunity. That means the natural immunity which is inside our body since childhood, since birth. The upper adaptive immunity. The adaptive immunity is also known as acquired immunity. It is also of two types. The one is natural and the other is artificial. The natural is of two types, passive and active, and the artificial is also of two types. The artificial immunity we get through medicines and immunization. You must have experienced the artificial immunization. And the natural immunization is passive. Vaccine, as you can see in the picture of an injection, vaccine is inactivated or vacant pathogen or their products that function as antigens or foreign agents and injected into the body. They in turn activate our immune system and produce antibodies during subsequent infection. Vaccines help to develop immunity and fight the infection or disease and prevent to occur in the future. The process of injecting vaccines as per age and other health conditions is referred to as immunization. There is immunization schedule developed at national level to protect the population, particularly the children. Vaccines are available for different diseases and given from birth at different time in life to provide lifetime protection from disease. Immunization, booster repeat doses of certain vaccines are recommended. For example, DPT requires booster dose. DPT is a short form. D is a different disease, P is a different disease, and T is a different disease. So this vaccine is used to fight for 3 different diseases, and a repeat booster dose is also required. The other is BCG. BCG is another important and popular vaccine, must be given for tuberculosis, we call TB. Now this is the chart. You can see and understand the immunization schedule in India for all people, for all our population. At the time of birth, BCG injection is given. When the child is 6 weeks, then polio drops are given. DPT immunization vaccine is given. Hepatitis B vaccine is given. When the child is 10 weeks, then repeat of these 3: oral polio drops, DPT vaccine, and hepatitis B is given. When the child is of 14 weeks, then again a booster dose is given: oral polio, DPT vaccine, hepatitis B vaccine. When the child is 9 months to 12 months old, then measles injection is given. There are some more booster doses at the age of 16 to 24 months. DPT and oral polio are given. When the child is 5 years old, DT dose is given. At 10 years and then again at 16 years, tetanus toxoid is given. At the age of 9, 18, 27, 30 and 36 months, vitamin A dose is given. And for a pregnant woman, tetanus toxoid 1 dose as early as possible during pregnancy is given. Second dose is given to the pregnant women 1 month after first dose. and a booster dose is given within the 3 years of the pregnancy. Immunization in India is given free of cost at all government dispensaries and hospitals. Primary immunization is scheduled in the first year of life to provide optimal protection to the infants. Any delay in following the immunization schedule exposes the infant to the risk of disease and harm to health. Hence, the timing, sequence, and frequency of the immunization should be followed. There is National Immunization Program for infants, children, and pregnant women. It is continuously updated by the Ministry of Health and Family Welfare under the national mission. I hope you must have understood the lesson 8, Health. You must read this lesson again from your book. Work hard and study well. Thank you.